Hi, I'm Brandon Rocque. I'm a neurosurgeon at Children's of Alabama, the University of Alabama at Birmingham, and I'm here to tell you a little bit about using the CPRN registry for research, specifically by giving you an example of a study that we're working on variation in patients getting selective dorsal rhizotomy. I have nothing relevant to disclose. So as you're probably aware, rhizotomy is an operation that's done to reduce spasticity in children with cerebral palsy. There's also a tremendous amount of variation in the way selective dorsal rhizotomy surgery is done. So setting aside the potential variation in how patients are referred for surgery or selected for surgery, there are a lot of variations in the way that surgery is performed in the actual surgical technique. So, for example, as seen here, this is from a paper several years ago. This just depicts some of the different options for the bony exposure that's done in order to get to the nerves where a rhizotomy is performed. And there's lots of different ways to do this. In addition, there's a lot of variation in where the nerves are accessed, how dorsal nerves are identified versus ventral nerves. Again, this is a dorsal rhizotomy, so picking dorsal from ventral is an important step. Lots of different ways that this is done. We did well, here's an example. One place you can do this dorsal versus ventral selection. Here's another. In addition to that, there have been some studies on the various techniques for how a nerve is selected, right? What type of electrical stimulus is used to pick out which nerves are more active, which nerves are less active, and thus picking which nerves should be sectioned in rhizotomy. And there's a tremendous amount of variability in that technique as well. We performed a special session at the 2020 AANS and CNS joint section on pediatric neurosurgery meeting, where several experts in rhizotomy, surgeons who perform rhizotomy, gave a brief presentation about their surgical technique and how they perform the operation. And it's really quite amazing to see how many different ways there are of doing this operation. So we set up a study using the data in the Cerebral Palsy Research Network registry, the CPRN registry, to really kind of quantify this variation, categorize this variation in rhizotomy technique. So step one is figure out what data are available. And as you can see here, we can use the CPRN registry elements report in order to get an idea of just how many patients there are in the registry that have these data. There's a little bit more granular data available for these reports now as well, and this is evolving as the Data Coordinating Center makes progress. But you can see here we have several patients in the registry that have had rhizotomy, so a good population that we might be able to study. So the next step in the CPRN process is for the potential investigator, in this case me, to create a concept cover page. And that includes these elements here, as you can see, a plan for funding, a little blurb about the importance of the topic, how CPRN is going to be able to address this, et cetera. Some discussion of the methodology, sample size requirements, and so forth. So I put together this cover page, and then the next step is to give a topic presentation, a concept presentation to the CPRN membership. So here you see a nice screenshot of me. Look at that, sitting in this very chair, in this very office, talking about this topic to the CPRN membership. After this, there is a vote by the investigators on whether we should proceed. And once that is done and approved, the next step is to meet with the CPRN data coordinating team. Here you see Dr. Stephen Wisniewski, who is the leader of the Data Coordinating Center at the University of Pittsburgh. So some back and forth conversations by email and phone and Zoom to really nail down what data we need, and then the DCC can go ahead and produce the reports for us. And I'll give you a little teaser here. This is a summary of the total number of patients in the registry who have had rhizotomy. You can see there are 182 children. You see the breakdown in sex, race, GMFCS level, movement disorders. And so we're working on analyzing these data right now, and with a plan to put forth a paper in the near future on the variation in rhizotomy technique captured by the CPRN registry. So in summary, what this allows us to do is leverage the large size of the CPRN. So a lot of patients in this registry. This specific study will allow us to frame future research questions and it will help us really nail down what additional variables are going to be needed for future studies to make this research more impactful. For now, it's only a study of variation, but hopefully in the future it will be a study of outcomes as well. It's an overview of how we use CPRN, how we can perform these data analysis, the investigators involved. And then, of course, this also represents an academic opportunity for young investigators. This is a great data set that is here. It's in existence. If you have an idea, a clinical question that you want to ask, this may be a good way to answer it and potentially provide some career advancement. So my pleasure to be able to talk with you about this today, and I appreciate the opportunity. Thank you.